Hello, my name's David Hinds, and I'm producing this video to hopefully make some sense out of COVID-19 and using modeling and analysis. You do see a lot of models being referred to in the media, and most of those are really meant to be basically predictive tools. So they try to predict the number of deaths, and they are used by policymakers to make some decisions. And my models that I'm presenting here are really meant to be not so much predictive tools, but really learning tools. So I try to make them, more transparent so you can see what's going on inside the model. And also, I try to set them up to play what if games. So I'll be doing that in this video to try to um, give some insight into how COVID kind of behaves and what are the implications and risks of decisions that are being made or will be made. I do what I mentioned in the front end. I'm not a medical doctor um, or an epidemiologist, but I am a modeler. I've done this for many years, since the 1970s, building and applying models. And most recently, I was associate professor and chair of decision science at Nova Southeastern University. Okay, so I'm really doing this two purposes, I guess. One is for individuals to hopefully help you to better understand basic terms and concepts about COVID 19, how the virus behaves in society, so you can pretty much independently assess the different claims that are made about the virus, because it's discouraging to see that many of these claims are misguided. So hopefully you'll be able to assess them after listening to this video. Um, as a decision maker, whether you're in the public sector or the private sector, um, I'm hoping to help you make more informed decisions by understanding those implications and risks of the decisions that you are making now and that you need to make. Now, in my first video, which I released April 20th, I introduced a 52-week projection model, and I explained the idea of the R number, reproduction number, sometimes referred to as infection rate. I showed why social distancing and testing are so important, kind of a high level, and I explained why rural states should be cautious about reopening because they really did not duck the wave. Rather, they are likely to still see this COVID wildfire break out in their states. And in fact, unfortunately, I think you're beginning to see that now with a lot of the rural and Midwestern states starting to feel the heat. So in this video, what I'm doing, I'm focusing in on the actual reopening decisions, and I created a model that calculates what I call caution levels for at the individual state and even the county level. This basically tells you how much caution your community or business leaders should be exercising as they make decisions to open up. So different states and even different counties have different levels from 1 to 5, depending on how much caution you need to be taking. It's not a formula for reopening. Basically, caution levels tell you how close you are to overloading your hospital capacity. They're built around the idea that your strategy is to basically keep infection levels under control and not let them reach critical levels where your IC beds are loaded and you've overloaded your fantastic healthcare workers. In terms of the R number, that means keeping R close to or below 1. Caution levels help you to do this and to manage infection levels under control by letting you know how ambitious you might want to be depending on where you stand in your state or county. So hopefully you can open up quickly, but without the need to pull back. The problem is there probably are going to be pullbacks needed because this is not an exact science. I mean, this is basically our first time doing this, and it's really an experiment. We don't really know what's going to happen as we open up, and we're dealing with a 2-week delay, which I'll talk about a little bit more in the cases that we see. So it's really trial and error, and I would hope that caution levels at least give you some indication of how ambitious you might want to be, and we, in this trial and error process, avoid having some big errors. Okay, so let's take a look at the model, and you can see on your screen here, I've entered all 50 states. of entered population. So there's basically two measures you have to get in order to run the model. You get average daily cases, which you enter here in this column. So for Alabama, 295 was the average daily cases over the past 7 days. The model then calculates from that number the percent of unoccupied ICU beds that are being taken up by COVID patients. So I'll explain that a little more in a minute. But there's where you're monitoring the extent to which you're overloading your healthcare system. The other key number is the famous R number, the reproduction number, or R naught, as we talked about it last time. That comes from a site called COVID Act Now, which is a terrific site, a lot of great information. They also have some predictive models there, but they do calculate R numbers for every state and most counties in the country. And so that's where these numbers came from as of April 30th. This is where you play some what-if games. I'll get back to that in a little bit. The model calculates the number of days until you overload your ICU beds, and that's what's here. And then here is the caution levels. There's a few other things here that I'll explain as I go along. So let me go ahead and sort this. So you see the caution levels are already calculated based on these two columns that I entered for each state. And here is the sheet where they're sorted by caution level. So you see at the top all the fives. These are the ones where you see basically extreme caution should be used in making any kind of open up decision. So let's see why. So you got Rhode Island right at the top here. And right now, the COVID patients are most likely taken up more than the capacity of the ICU beds. Now, let me explain how this works. So the 148% is saying, given these 259 average daily cases in a state having just about 1 million people, that's probably where they're at. But these are based on national averages. So some of these numbers, are not meant to be exact, but they do give you an idea of where different states stand. So over here on this side, you can see how I calculate the 148%. I estimate the total ICU beds right there in Rhode Island based on, typical national averages. So they should have, based on their population, about 362 beds. Normally, beds are 2/3 occupied. So 243 beds are already taken up with other patients, not COVID patients. So that leaves 120 available for COVID patients. Right now, based on the average daily cases, or in the near future, the ICU beds needed for COVID is 176. So you can see they've gone over the 120 available. So that's 148% of unoccupied beds for COVID. And what that basically means is they're kicking out patients from the ICU that should have been there, or normally would have been there for other reasons. In reality, what we're seeing happening is a lot of those patients don't end up even coming into the hospital. But that's not a good thing because, we're seeing, more patients have trouble at home and even dying at home because of that. So that's where the 148% comes from. So you got Rhode Island, 148%. They're really stressing their healthcare system. They're a caution level 5. So caution level 5 says ICUs are full right now, which they are in Rhode Island, or they will be full within 28 days. Okay, so let's look at that. So all these here, New Jersey is full, Massachusetts is full. Now, Maryland just filled up, and they are in the red, of course. Now you have Iowa. So Iowa is 98%. They haven't yet filled it up. But over here, the number of days until they fill up, because they have an R of 1.27, they're growing quite quickly in terms of their infections. So within a day, they will be overloaded. Go down here, Minnesota, within 7 days, they'll be overloaded. So the very bottom one in the group is New Hampshire. So they're at 44%, but because they have such a high R, within the 28 days, here it's 27 exactly, they will be overloading their healthcare system. Now, I just want to point out, I've added in another number here. This really pretty interesting. This is called the Stay at Home Index. And this comes from a company. Here's the website. You can find it, safegraph.com. And these are indications based on millions of cell phones being tracked on an anonymous basis, hopefully, that that show how much mobility or movement is going on now versus before we really responded to COVID, which going back to say early February. So the 17.1 for Rhode Island means that whatever percentage of population in Rhode Island were staying at home, let's say that was 20%. Now there's 37.1% staying at home. So this is the increase in stay at home mobility or behavior that has resulted from before COVID to now. So a high number means you're really staying at home. Rhode Island is. New Jersey, I think, is pretty much the top, 25%. So they're really staying at home. Massachusetts, high. The overall U.S. average is 13.5, to give you an idea. Now, Nebraska, not so high, below average. Iowa, below average. So that just gives you, it doesn't really play into the caution level, but I put it here because I think it does shed some light on why states are where they are in terms of these models. So if you look at Nebraska, not social distancing to a great extent compared to other states. They've got an R number of 1.32. That's very serious. And in fact, it's already overloading their healthcare system and will continue to do so if they don't do something about it. Will get even worse and worse. The same with Iowa. Okay, these are smaller states that you wouldn't expect would be in the red yet, but they've got there partly because of maybe social distancing, but also these states tend to have these super spreader sites like meat packing plants and prisons and so forth. So basically, if your state is in the red, level 5, your decision maker should be using extreme caution in making opening up decisions. It doesn't mean they won't open up. And in fact, what you'll see is you really have to look at, especially the larger states, different regions and different urban areas. So what Governor Cuomo is going to do in the New York City area is going to be very different than how he handles opening up in the northern part of the state. And I'll be showing you that in a little bit. Okay, so those are the level 5. Now we come down to level 4. So these are not yet filled. So you see the occupancies, the highest is South Dakota at 60, 55 going down. The lowest is 15% in South Carolina. So they really don't have much load right now on their health care. But because they have the 1.14, all it's going to take, so you see the orange level 4 says a 10% increase in R is going to fill up the ICU within 60 days. So that's the idea that, all right, you got a little bit room, but you see as soon as I put 10%, watch what happens to the number of days right to the right of it. It goes from 102 to 59. So already we're under the 60 days, and that's what put it into the orange category. Because when you do the 10% increase, see, R was 114, but 10% means now R is 125 after some opening decision, for example. Ohio is an interesting example. They're relatively low here, and this is not a bad number, but it is still above 1. Right now, if they continue without doing anything, it'll be 166 days before they load up their ICUs, which is not bad. But watch how quickly. 10% increase, it's 56 days. 20% increase, it's 35 days. So that's why it's very sensitive to these, 10%, 20% increases. And again, we don't know what is a 10%. If you let people onto beaches and into restaurants, is that 20%? Is that 10%? We just really don't know. So that's why this is more of a what if thing to see what the potential implications are. Let me put that back to 0. Interesting to note, most of the states in the level 4 category you see over here, they're all not social distancing very much compared to the national average, except for Pennsylvania and Virginia. But most of these are, maybe got into the 4 category because they haven't been social distancing. Now, South Dakota is interesting. They're flat right now, a 1. That's why it doesn't show any days to occupancy, because at 1, they theoretically stay at 88 cases a day and they stay at 60% capacity. But it doesn't take much. As soon as they have a 10% increase, you see it goes to 37 days. That's why they're in this category. Okay, so orange says still very high caution. Now let's come down to the yellow. And here, so now we have still Connecticut at 88%. They're close to capacity, but they have a good number here, 0.91. Remember, below 1 means cases are going to be going down. So that's good, but it still doesn't help for when you add 10%. All right, now 881 days, still not bad. 20%, this is into 10 days. Okay, so you see how sensitive that is. So still, we're still in a high caution here, but you just have to be careful and watch it. Let's look at Georgia. Okay, Georgia gets a lot of press. So they're at 39%, not too bad in ICUs, and 98.98, which is borderline, but still, if you do, so let's say they had 10% from their opening decisions, it's still 87 days away from overloading. 20% puts them 40 days. So I mean, there's some room, not a ton of room, but I think doing some opening is not unwarranted. Again, though, you have to look at areas of the state. So this is Georgia as a whole, and you have to look at your urban areas separately. I'll show you some more detail on that in a little bit. Get into the next level down, level 2. Okay. Now we have New York here. Wow. Why is that? Well, again, overall, the whole state of New York is 0.79, which is great. 0.98 means they're still close to capacity in ICUs, but because of 0.79, that'll go down. But I've specifically broken out a few counties in New York down here so you can see what's going on. So in New York County, and there is a New York County, I never knew this till I did this. It actually has about 1,600,000 people. Here's their average daily cases. So they're running close to ICU capacity, but not bad. And they're 0.72. They're really distancing. Over here, look at that, 20.7 social distancing. So that's really caused this R to be low. They're driving this number down. So based on my rating system at the current trajectory, it would take a 40% increase to get them back in a bad trajectory. So that's great news. But then very nearby, Rockland County, about an hour north of the city, they're still overloaded in ICU usage. The 0.92 is good, but it's not great. So they're right now, overloaded. So they're in a 5. And then if you go further upstate, Monroe, which I think is like the Rochester area, they look more like a typical maybe, location in a county in other states. Relatively low here, 1.14, but they're a very high risk because a 10% increase drops them within the 60 days. Okay, so again, shows you why you have to split that out. Come back here. Kind of interesting note, look at West Virginia and Idaho. They're down in this level 2 category, and they've been distancing 7 and 8. It's not great, but it's better than some of these ones up here like Wyoming, 4.2, and so forth. So, being a little bit higher distancing might have earned them that right to be in the level 2 caution category. Level 1, look at this, Florida. I didn't do that just because I live here. So why is Florida a 1? Well, we're pretty low on the ICU bed occupancy, and a 0.88 is a good number for R. And we have been distancing. See, Florida overall has been distancing better than the U.S. So we're in the category that it would take a 40% increase to get us into that bad trajectory. But it can happen. Again, you want to break it out. So here I've broken it out into the South Florida counties. We live here in Broward. So in Broward, um, it's not quite as rosy a picture because we're in the high caution category. A 20% increase would put us on a trajectory to overload within 60 days. Um, Miami-Dade and Palm Beach are even a little bit worse. In Palm Beach, 10% in 42 days they'll be overloaded, 20%, 28 days they'll be overloaded. Otherwise, the other, Vermont. So I would say, in Florida, I think we're in this category partly because overall we have been doing a pretty good job of distancing. If you look at the distancing in South Florida, it's been really good. Look, 20, 20, 17, equivalent to the Northeast. Um, Vermont, maybe. So in some respects, Florida, we may have kind of earned our way into here. I sort of suspect there is a heat and humidity factor to this as well. We had a pretty hot and humid spring. But in any event, that's where we are. Otherwise, you got some really incredible ones here. Alaska, Hawaii, and Montana are all pretty unusual situations. Okay, so that's pretty much it as far as understanding this and hopefully giving you some insight. Just caution you, these numbers are only good as the input data. So the input data is really the average daily cases. And that's a function of how good the testing is. So if that testing is not so reliable, then those numbers won't be reliable, and this, may not be entirely accurate. But I do believe the numbers are good enough to make these kind of comparisons I'm looking at and showing you here, and to do some of the what if games. I will post the spreadsheet to my website, so you feel free to download it and use it just for the data or to play with it. My website is essenceoflean.com. So to wrap up, there's no doubt as we open up, that means increasing mobility. Mobility is the term we're using now for opening up. It's really key to cell phone mobility. As we open up, it will increase R. We just don't know by how much. And the fact that we have that uncertainty combined with the exponential viral growth that we see, that leads to health risk that decision makers need to consider. And these kinds of analyses, and hopefully others will do this, help decision makers to at least understand those risks. Now, they have to be balanced. Those are health risks. I'm not addressing economic risk, and you have to address the economic risk of not opening up and not increasing mobility. So, not an easy decision, but it's best to have as many numbers as you can and assistance, and at least being informed in making those decisions. So the bottom line is, the question is not, yes or no to open. The question is how much and how soon. We, of course, have to move forward, but we should do it in a smart and managed way that involves, being just ambitious enough to hopefully avoid pullbacks if possible. We have to watch closely. That's where testing comes in. We have to be able to see what's happening. Right now, we're probably on a 2-week delay on that, and be ready to pull back if necessary. So I hope that's been helpful. I ask myself, you may ask, and I've asked myself, why do I do this? But, it's been said that knowledge is power. And in these kind of troubling times, I believe that knowledge is gold. At least for me, having more knowledge can reduce my anxiety. And I hope it does for you too. When you're not sure of things, it can be very scary. So anyway, I hope it's been helpful to you, and I appreciate your listening.